Confronting the Cancer Care Plight, using first principles to navigate your cancer journey, is more than just a book. It serves as a beacon of hope for individuals facing cancer. Living long enough almost inevitably brings you face to face with cancer, with the lifetime risk of developing it nearing 20%. In 2022, nearly 20 million new cases of cancer were reported worldwide, with 9.7 million people dying from the disease. While the United States is often viewed as a frontrunner in cancer care, its cancer death rate does not significantly surpass global standards. The U.S. cancer death rates are lower than in certain developed nations but align with China's and exceed those of Brazil, India, and Indonesia, three emerging countries. When considering age adjustments, most countries globally generally report cancer death rates ranging from 80 to 100 per 100,000 individuals, with minimal variations between nations, except for India, which is slightly lower. For cancer patients in the U.S., even with access to advanced medical care, substantial health insurance, and the latest anti-cancer drugs and technologies, their survival time may not be longer than that of patients in China who are treated with the most cost-effective medications. When a cancer patient visits a hospital, the doctor will offer the following treatment options: surgery, interventional therapy, chemotherapy, radiation therapy, bone marrow transplant, immunotherapy, hormone therapy, and targeted drug therapy. With hundreds of cancer treatment methods available, theoretically, there is always one that might suit you. But sometimes having too many options can feel overwhelming. In cancer research, researchers often pursue complex technologies, while in clinical diagnosis, there is a tendency towards overtreatment. This can be seen in clinical guidelines and doctors' preference for short-term effective treatments, overlooking long-term negative impacts such as side effects, drug resistance, and unsustainable therapies. Cancer treatment limitations, which significantly impact patient care, stem from the following four factors: traditional views factors, healthcare system factors, physician factors, patient factors. Traditional views factors: early detection and treatment lead to overtreatment. Advanced technologies do not necessarily yield long-term effects. High mortality rates undermine patient confidence. Healthcare system factors: treatment plans do not target long-term patient benefits. Standard treatments limit individual choices. Strict regulations hinder innovation. Physician factors: tendency to overtreat under standard treatment protocols. Significant decision-making power, but treatment choices are random. Long-term patient benefits are often overlooked in treatment decisions. Patient factors: patients seldom participate in decision-making, overlooking true goals. Fear of cancer impedes clear understanding. Lack of proper standards for evaluating treatment options. Patients must change their mindset and learn new ways of thinking to improve their cancer treatment outcomes. Just as SpaceX has developed reusable rockets, the field of cancer treatment needs to break from tradition and find truly effective treatments. By applying first principles, starting from basic principles and re-evaluating existing treatment methods, we might find more effective treatment options. This allows patients to precisely choose the most beneficial treatment from the standard options recommended by doctors. This is not just a choice of treatment but a respect for and responsibility towards life. The importance of first principles thinking and analysis lies not only in its ability to help us break down data, but also in encouraging us to question and understand the fundamental elements that constitute the data. This method includes the following key steps: clarify the problem, decompose the problem, analyze basic components, recombine information. When applying first principles to cancer treatment, we made some adjustments to the specific steps. We emphasize the importance of directing our efforts towards eradicating cancer cells while safeguarding healthy ones to enhance a patient's quality of life. We advocate for a pragmatic approach in cancer treatment, prioritizing practical strategies over a comprehensive understanding of all causes. Breaking down the issue involves grasping the essence of cancer, treatment objectives, and methods. Current challenges in cancer treatment encompass therapies concentrated on immediate gains and the intricacies of molecular-level treatments. Our analysis proposes a transition towards concentrating on fundamental components at the cellular level for enhanced efficacy in cancer treatment. In the recombine information step, we create a life model. The human body consists of about 50 trillion cells. When the ratio of aging cells, such as senescent cells, surpasses a set threshold, the individual's functions decline, leading to death. Excessive dysfunctional cells in a specific area beyond a certain level signify the onset of a disease. The body's natural mechanisms, including the immune system, strive to hinder or diminish the accumulation of these aging cells. Due to the data on cancer showing a direct link with aging, we can conclude that cancer is a part of the aging process. By applying life model principles, we substitute aging cells with cancer cells to form a mathematical model for cancer. In the cancer model, we explore an optimal approach to cancer treatment that centers on eradicating cancer cells while preserving immune function to prolong a patient's lifespan. By utilizing cancer models, we can pinpoint 5 essential factors crucial for achieving the ultimate objectives of cancer treatment. This is known as the 5-factor assessment framework. These factors include the rate of inhibition, safety, resistance, sustainability, and convenience. Each of these factors plays a critical role in determining the potential success of cancer treatment in the long run. The significance of inhibition rate in cancer treatment lies in therapies that combine direct cancer cell elimination and immune system activation for effective treatment. The importance of safety in cancer treatment is highlighted, emphasizing the need for therapies with fewer side effects and higher safety levels to enhance patient outcomes. When our discussion delves into drug resistance in cancer treatment, we concentrate on the obstacles of targeting precise mutations and the evolution of resistance. We emphasize the importance of striking a balance between short-term tumor control and long-term patient well-being, suggesting a reassessment of treatment approaches to reduce resistance and enhance benefits. The sustainability of cancer treatment is vital, focusing on consistently killing cancer cells, reducing cancer burden, and prolonging life. Safety, drug resistance, and surgical removal impact sustainability. Patients should prioritize sustainable treatments for long-term benefits. We value convenience in healthcare decisions, considering its influence on treatment choices and patient preferences. Patients should weigh convenience with other factors for informed decisions. Applying the 5-factor assessment framework, we start with the NCCN guidelines, established by the National Comprehensive Cancer Network. These evidence-based guidelines standardize cancer care approaches, covering prevention, diagnosis, treatment, follow-up, and palliative care. They are globally recognized as authoritative resources in cancer treatment. Steps for selecting treatments from the NCCN guidelines using the framework. Initial recommendation, AI expansion, evaluate options, patient-doctor discussion, final decision. By assessing each treatment's performance on these factors, we gauge its long-term cancer control capability, enabling comprehensive scoring and prioritization of treatments with higher scores. Just like choosing the best therapy methods in the NCCN guidelines, cancer patients can include off-label treatment options under the Helsinki Declaration. By using a 5-factor scoring method, all options are assessed collectively, and the cancer treatment plan with the highest weighted average score is chosen. Innovative combination therapies. We have revolutionized the analysis model and evaluation framework for cancer treatment by adhering to core principles. Our innovation goes beyond traditional cancer treatments outlined in the NCCN guidelines, focusing on the selection process and integrating cutting-edge therapies. Transition from systemic medication to intratumoral injection. While integrating groundbreaking cancer treatments presents challenges within the current healthcare landscape, our strategic thinking methodology envisions enhanced possibilities for cancer treatment. The shift from systemic medication to intratumoral injection marks a progressive move towards personalized and targeted therapies. Development directions of intratumoral injection drugs. Utilizing the 5-factor assessment framework grounded in fundamental principles, we foresee the future path of innovative cancer therapies. The development directions of intratumoral injection drugs represent a logical progression, offering promising avenues for more effective and precise cancer treatments.